Hello and welcome. The following is a presentation offered by Consumers for Affordable Healthcare to help consumers use CoverME.gov's Plan Compare tool. Consumers for Affordable Healthcare is Maine's health insurance consumer assistance program. Consumers for Affordable Healthcare's mission is to help all Mainers enroll in, understand, and use their healthcare coverage. The Plan Compare tool at CoverME.gov will allow you to estimate your financial assistance, know which plans will cover your doctors, hospitals, and prescriptions, what portion of your healthcare costs a carrier will pay, and allow you to filter and compare plans. To find the Plan Compare tool at CoverMe.gov, you can click on Compare Plans under the Get Started tab, or scroll down and click on See 2024 Plans. Start using the Plan Compare tool by entering the zip code for the town you live in. Then click Start Looking for Plans. Next, you will build your household. Include all members of your household, including yourself and your spouse. There are some exceptions to listing a spouse here or on your application. If you are a victim of domestic violence, you have been abandoned by your spouse, or you file as head of household. Add a domestic partner here if you claim them as a dependent or if you have a child together, and any claimed dependents, including students up to age 24. If anyone in your household already has coverage through an employer, Maine Care, Medicare, etc., please be sure to check the box that they are not seeking any coverage. Then click Next Step. In this next step, you will enter your total projected household income for 2024. It is important to be as accurate as possible. If your estimate changes as the year goes on, you can update your income at any time. Below you will see a short list of what income counts and what income does not count. Click on Estimate Financial Assistance once you have come up with your most accurate projected income for 2024. Your estimated financial assistance will include assessment for Marketplace and Maine Care for members of your household who appear eligible based on the information you provided. It is important to remember that eligibility assessments will only appear here for members of your household who are seeking coverage. A Maine Care eligibility assessment may be made for dependents under 21 and persons who are pregnant at the time of application if they need coverage and meet the income guidelines. On this page, you will see estimated premiums, APTCs, and cost-sharing reductions for individuals assessed as Marketplace eligible. Once you have reviewed this page, click Next Steps. On this page, you will enter all doctors and specialists you or other plan members will see. You will need to expand the search area if they are more than 25 miles from your zip code. Enter the hospital or hospitals you use most, and enter all medications and their dosage that you take regularly. This is an important part of determining if a plan will cover the care you need. Then click on Browse Marketplace Plans. While you wait for CoverMe to find plans, consider your medical coverage needs. Do you anticipate any major medical procedures? Do you have a chronic condition that requires regular medication and/or specialist visits? Is anyone in your household pregnant or planning on getting pregnant in the coming year? Do you have follow-up visits planned in the coming year? Will you be getting physical therapy? Do you regularly visit a chiropractor or an acupuncturist? Click Continue to Plans to move forward. Insurance plans at CoverMe.gov come in 4 metal levels. Bronze plans have lower premiums and the highest out-of-pocket costs. Silver plans have slightly higher premiums and relatively lower out-of-pocket costs. Cost-sharing reductions can be found only in silver plans and help make it cheaper for consumers to get coverage with lower out-of-pocket costs. Gold plans have high premiums and lower out-of-pocket costs. Platinum plans have the highest premiums and the lowest out-of-pocket costs. It's important to remember that these are general rules regarding metal levels. Depending on the kind of medical care an applicant typically seeks or how often they need it, will play a significant role in the affordability of a plan. For instance, if a specialist is in network for a silver plan, but out of network in a gold plan, it may be that the silver plan, especially if CSRs are applied, is the cheaper option. We will go into those details in coming slides. It's also important to note that individuals under 30 can enroll in a catastrophic plan. However, APTCs cannot be applied to this kind of coverage. It helps to understand a few common health insurance terms when shopping for a plan. A premium is the monthly plan payment. You pay this whether you use your coverage or not, and even if you meet your out-of-pocket maximum. A deductible is the full cost paid for services, both medical and drug, until the deductible is met. Some plans cover services like office visits before the deductible is met. Some plans are tiered. Preferred tier providers have a lower copay. Non-preferred tiers are higher. Your out-of-pocket limit is the maximum amount you will pay for medical care in a year, premiums excluded. A copay is the amount you pay each time you have an office visit or other service. Different provider types have different copays. Annual physicals have no copay. Preferred or non-preferred tiers apply. Coinsurance is a portion of medical care you share with the insurance company after you meet your deductible, but before you meet your out-of-pocket limit. Some prescriptions cost less than others. Preferred, generic, and specialty drugs will have different costs, including copays, a fee you pay when you get your prescription, or coinsurance after the deductible is met. Choosing your health plan. Are your doctors covered? Insurance companies contract with providers to set a price for services. If carriers get a better price, so will you. In the Plan Compare tool, providers with the green check mark are in-network and will cost the least. Providers with a yellow check mark are non-preferred network providers, sometimes called Tier 2, and they will cost more. Providers with a red exclamation point are out of network and will not be covered by your plan. Just like they do with providers, insurance carriers get better prices for some medications. Drugs are offered in different tiers or as preferred. Drugs with the green check mark are covered. Hover over your drug list for information about how this plan will help pay for your medications. Drugs with a red exclamation point are not covered by the carrier and will cost the most. We recommend double-checking carrier drug lists if a medication is not showing as covered. Sometimes the Plan Compare tool is missing information that might influence your choice. As you can see in this example, some of the medications we listed are covered and some aren't. In this case, there are brand name drugs like Neurontin and the generic version, gabapentin. This illustrates how carriers are more likely to pay for a cheaper drug than more expensive alternatives. Next to each plan name is a View Details button. This allows applicants to do a deeper dive into what is covered and what is not. Here you will find links to the insurance company's provider directories and drug search tools that may be more accurate than the Plan Compare tool. Viewing the plan details gives you more information about the doctors, hospitals, and medications you listed, as well as the cost for labs and imaging, urgent care or emergency room visits, prenatal care and delivery, and hospital stays. By clicking the Compare box on up to 3 plans, it is possible to do a side-by-side comparison of plan details like premium, deductibles, and out-of-pocket costs. In either View Plan Details or when comparing plans, it is easy to find a drop-down menu for various categories that provides detailed information about network status, copays, deductibles, and coinsurance. The plan you choose should have premiums and copays that fit your budget, have a manageable deductible based on your anticipated medical needs for 2024, provide in-network coverage for the doctors and hospitals you will use most, cover the prescriptions you take regularly, and covers any other practitioners or services you regularly use, such as physical therapy, routine lab work, imaging, etc. It is very important to note that the Plan Compare tool is separate from the CoverME.gov application. When you have made your selection, write down or take a screenshot of the plan you have chosen. Look for your plan when you reach the Select Plan section of your CoverME.gov application. By now, you should have a good sense of how to use the Plan Compare tool to pick a plan that will work best for you. We would like to point out that even if you have marketplace coverage, you may also qualify for other programs that can help pay for out-of-pocket costs like deductibles and prescriptions. Consumers for Affordable Healthcare is a resource for consumers whether they are covered or not. If you need help understanding your plan, updating your application, applying for hospital-free care, or transitioning to other coverage, you can call us Monday through Friday, 8:30 a.m. to 4:30 p.m. at 1-800-965-7476. Thank you for watching this presentation on how to use the Plan Compare tool. Consumers for Affordable Healthcare hopes it was helpful, and we look forward to helping you again if you need us in the future.